Hi students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we are going to discuss about the menopause. So menopause is a physiological event which happens in every female's life. So as a clinician, it is very important to learn about menopause. So menopause is also a very important topic in your MCQ based examination as well, right? So let's start with the topic. So we are going to divide this menopause into two terms. It is meno and pause. So what do you mean by meno? So meno stands for menstruation and pause stands for stop. So it is actually stoppage of menstruation in a female's life. So when does this going to happen? So what is menopause actually? So menopause is actually permanent cessation of menstruation. So permanently a female has stopped menstruating. So what is the actual cause for this permanent cessation of menstruation? We'll be discussing now. But when are you going to define a female that she has attained menopause? If a female is going to experience amenorrhea, that is absence of menstruation, for a period of about 12 months or 1 year, she can be said that she is clinically diagnosed as a case of menopause. If a female is not going to have any cycle for the next consecutive 12 months or 1 year, you can tell clinically that she has attained menopause. Is that clear? Yes, so that is the ideal definition of menopause. So now, what is the most common age group for attainment of menopause in India? So the most common age group for attainment of menopause in Indian females is around 47 to 51 years. You always need to tell the years in a variable because you cannot tell that menopause occurs at 47 years of age. You cannot be very sure that it will occur only at 47 years. You have to give a variable, right? So it is around 47 to 51 years of age. More commonly, most of the females attain menopause between 47 to 51 years in India. So the most common age group is around 47 to 51 years. So having discussed about what is menopause, now what is premature menopause? So before discussing about premature menopause, let me tell you why menopause occurs. So this is the most common question everyone have. So why menopause occurs? So before discussing about why menopause occurs, let's discuss about the physiology of ovarian follicles. We all know that ovarian follicles are only infinite number in a female's life, right? So even when a female fetus is in her mother's uterus, the number of ovarian follicle is going to be only predefined. That is around 5th month of the intrauterine life, the female fetus ovary is going to have the maximum number of ovarian follicle, that is around 6 to 7 million ovarian follicle. So 6 to 7 million ovarian follicle is present in the ovary of the female fetus during the intrauterine life when the fetus is in the mother's uterus. The 6 to 7 million follicle is actually going to get depleted and become 1 to 2 million at the time of birth of the female fetus. At the time of birth of the female fetus, the number of follicles is actually going to get decreased and become 1 to 2 million ovarian follicles. So now the fetus has born, and around 10 to 12 years of age, when the female fetus is going to attain puberty, around the time of puberty, the number of ovarian follicle is further going to decrease and it is going to become around 4 to 5 lakhs ovarian follicle. So as you can see here, right from the 5th month of intrauterine life, when the ovarian follicles are maximum in number and at around the time of birth and around the time of puberty, the number of ovarian follicle is actually getting decreased. From 6 to 7 million, it became 1 to 2 million, and from 1 to 2 million, it became 4 to 5 lakhs ovarian follicle. So why does this happen? This happens because the number of ovarian follicles are going to be predefined in a female fetus, right? This ovarian follicle is actually going to undergo programmed cell death, which is called as apoptosis, and it is going to decrease further. So after puberty, when the female fetus is going to attain menstruation every single month, every month the number of the ovarian follicle is going to undergo programmed cell death and decrease in number. So right from the 5th month of intrauterine life, the ovarian follicles were undergoing programmed cell death and it became 1 to 2 million. After it became 4 to 5 lakhs. So even after puberty, these ovarian follicles are going to undergo apoptosis and decrease in number. So as the female is going to menstruate every single month for the next 20 to 30 years, every month the number of follicle is going to get depleted through apoptosis. By around 47 to 51 years, the number of ovarian follicles in the ovary of the female is going to get decreased, and finally there is no more ovarian follicles which are left in the female's ovary. So when there is going to be no ovarian follicles left in the female's ovary, there is going to be no ovulation which is going to happen in that female. We all know that ovulation occurs at around day 14 of the menstrual cycle. So menstrual cycle can be tell like 28-day cycle. Let's take 14-day, around 14th day of the menstrual cycle, ovulation is going to happen. So ovulation is the process where there is going to be release of a mature ovum. Along with the mature ovum, there is going to be release of the corpus luteum. So corpus luteum majorly secretes progesterone. This progesterone hormone is the hormone which is going to be maximum in the second half of the menstrual cycle. By around day 22 of the menstrual cycle, the levels of progesterone are high in the female's body. This progesterone is going to decrease later. How it decreases? Because the corpus luteum is going to get degenerated in the later half of the menstrual cycle. So once the corpus luteum is going to get degenerated, the levels of progesterone is actually going to decrease suddenly in the female. So this sudden decrease in the levels of progesterone in the female because of this degeneration of corpus luteum is called as progesterone withdrawal. So once there is going to be progesterone withdrawal, the support to the uterine endometrium is going to be lost, because progesterone is the hormone which is majorly supporting the uterine endometrium, right? So when the progesterone is going to decrease suddenly, which is called as progesterone withdrawal, the female is going to experience menstruation as a result of loss of support to the uterine endometrium. So the most important thing for menstruation to happen is ovulation followed by release of corpus luteum followed by release of progesterone, and progesterone withdrawal is very important for menstruation to happen in a female. So for all these things to happen, ovulation has to happen at around day 14 of the menstrual cycle. But in a female who has attained menopause, the number of ovarian follicles are nil. There is no ovarian follicle left over. So when there is going to be no ovulation in that female, there is going to be no progesterone formation, there is going to be no menstruation in that female. So because of that reason, because of no more ovarian follicles, no menstruation is going to happen in that female, which is called as menopause. Is that clear? So majorly menopause is because of ovarian insufficiency. There are no more ovarian follicles which are left in that female. So menopause can also be called as ovarian insufficiency. Now, what is called as premature menopause? Premature menopause is when a female is going to attain menopause at less than 40 years of age. We all know that the most common age group for attainment of menopause in females in India is around 47 to 51 years. But for some reason, if a female is going to attain menopause at less than 40 years of age, she can be called as a case of premature menopause. Now this premature menopause has been given a term which is called as primary ovarian insufficiency. So primarily there is ovarian insufficiency in that female. Because of that reason, she has attained menopause at less than 47 years of age. So at less than 40 years itself, the female has attained menopause due to some reason. So we'll be discussing about this premature menopause in a separate module, right? As of now, you need to learn that premature menopause is when a female is going to attain menopause at less than 40 years of age, and it is also called as primary ovarian insufficiency, POI. Is that clear? Yes. So having discussed about premature menopause, now the contrary is delayed or late onset menopause. What is delayed or late onset menopause? Let's say, for example, a female is going to attain menopause at more than 55 years of age, which is more than 47 to 51 years. The most common age for attainment of menopause in India is around 47 to 51 years. But if a female is going to experience menopause only after 55 years, she can be called as a case of delayed or late onset menopause. So, since this female is exposed to increased amount of estrogen during this 4 to 5 years, let's say that if a female is going to attain menopause by around 50 years of age, there is going to be no ovulation in her, there is going to be decrease in amount of estrogen and progesterone in her, there is going to be no menstruation in her. So when the levels of estrogen and progesterone is decreased in her, therefore she is not at risk of developing endometrial and ovarian cancer. Because we all know that estrogen is very important risk factor for the development of endometrial and ovarian cancer. Why? Because is that increased amount of estrogen is going to result in proliferation of the uterine endometrium, which will result in endometrial hyperplasia followed by development of endometrial cancer. And for ovarian cancer also, estrogen is the most common risk factor. So since this female has attained menopause by 50 years of age, she is not exposed to estrogen after 50 years. So since she is not exposed to estrogen after 50 years, she is not at risk of developing endometrial and ovarian cancer. But in females of delayed or late onset menopause, the female is going to attain menopause at only more than 55 years of age. So she is actually exposed to estrogen for the extra 4 to 5 years of age. Commonly, menopause occurs at 50 years, but she is attaining only at 55 years. So more than equal to 4-5 years, she has been exposed to estrogen. So since she is exposed to estrogen for the extra 4 to 5 years, she is at risk of developing endometrial cancer and ovarian cancer. Is that clear? So late onset menopause, it is a risk factor for development of endometrial and ovarian cancer. The reason is that she is being exposed to estrogen for the additional 4 to 5 years. Is that clear? Yes. Okay. Now what is perimenopausal age group? What is perimenopausal age group? So menopause is attainment of menopause is attainment of permanent cessation of menstruation. The most common age group is 47 to 51 years. But perimenopause stands for the period of 4 to 5 years before the attainment of menopause. Menopause age group is 47 to 51 years. Perimenopause is 4 to 5 years before 47 to 51 years of age is called as perimenopausal age group. So what happens in this 4 to 5 years before the onset of menopause? Transition to menopause occurs during this perimenopausal age. So 4 to 5 years before the attainment of menopause in a female can be called as perimenopausal age. So during this perimenopausal age, the transition to menopause is going to happen. Suddenly menopause doesn't occur, right? So some transition has to occur in a female towards attaining menopause. So this transition occurs in the perimenopausal age. So what is this transition? The first important transition is that the regular cycle, the female was experiencing regular cycles previously. Now the cycle is going to become irregular, where the cycle length, the length of the cycle is going to increase. Let's say, for example, initially if a female has been experiencing cycle every 30 days, now she'll be experiencing cycles every 50 days. So only for every 50 days she is going to have a menstrual cycle. So initially she is experiencing cycles every 30 days. Now she is going to experience every 50 days. After that, she might be going for a period of amenorrhea, that is absence of menstruation. And after few months of absence of menstruation, she might be having her next cycle after 30 or 40 days. So ideally the cycle is becoming irregular. So this cycle becoming irregular 4 to 5 years before the attainment of menopause is actually the transition which is happening in that female towards the attainment of menopause. So this is called as perimenopausal age group transition. Is that clear? Yes. Okay, so having discussed about what is menopause, why menopause occurs, and what is actually premature menopause and what is delayed onset menopause, now what are the symptoms of perimenopause and menopause? So the most common symptom is menstrual irregularity. The cycles are going to get irregular. Why these cycles are irregular? Because towards the attainment of menopause, once the female is going to attain menopause, there is going to be an ovulation happening in that female, because the number of ovarian follicles are going to be depleted completely in that female. Once the number of ovarian follicles is going to get decreased, there is going to be no ovulation happening in that female, which is called as anovulation. When there is an ovulation, there is going to be no release of corpus luteum, no progesterone, then there is going to be no progesterone withdrawal. If there is going to be no progesterone withdrawal, there is going to be no menstruation, which is called as amenorrhea or absence of menstruation. So menstrual irregularities, the symptom of perimenopause and menopausal age group female. But what is the most common symptom which is experienced by female of menopause? The most common symptom of menopause is hot flashes. Hot flashes. It's a very modern term, right? Hot flashes. So hot flashes is also called as night sweats. Hot flashes is also called as night sweats. It occurs more commonly at night, but then it can occur during any time of the day as well. Is that clear? Okay. So now what is hot flashes? So in simple term, hot flashes is nothing but it is a sensation of heat over the face and the upper chest. So over the face and the upper chest, the female is going to experience a sensation of heat. So this sensation of heat is going to happen, and following this heat she is going to have sweating, shivering and palpitations and everything. So basically hot flashes is a vasomotor symptom. So because of the vasomotor changes, the patient is going to experience some sensation of heat over the face and the upper chest, followed by shivering, sweating and palpitation. So this symptom will last for about 2 to 5 minutes. It lasts only for 2 to 5 minutes and then she will be apparently normal. So now you tell me, what is the actual reason for this hot flashes? So hot flashes is a vasomotor symptom which happens because of decrease in levels of estrogen. We all know that towards the attainment of menopause, when there is going to be no ovulation happening in that female, therefore there is going to be decrease in amount of estrogen and progesterone. Right? So when there is going to be decrease in levels of estrogen in a female of menopause, there could be hot flashes in that female as well. So one reason is decrease in estrogen. The other reason is that because of decrease in estrogen, there could be some imbalances between hormones such as the serotonin and the norepinephrine. Because of imbalance between the hormonal imbalances the female is going to experience, she might have this vasomotor symptom, that is hot flashes or night sweats. And in females of menopause, the thermoneutral zone is a zone which is going to maintain the temperature of every person's body. In patients of menopause, this thermoneutral zone is actually going to get narrowed. So since the thermoneutral zone is going to get narrowed, there is going to be thermoregulatory dysfunction which is going to happen at the level of hypothalamus. So since the thermoneutral zone is going to get narrowed in patients of menopause, there is going to be thermoregulatory dysfunction at the level of hypothalamus, which could be a reason for this sudden sensation of heat over the face and upper chest the female is going to experience. So we have seen that the most common symptom of menopause is hot flashes or night sweats, and the causes of menopause the causes of hot flashes have been discussed as well. Is that clear? Yes. The most important point is that once the female is going to experience menopause, at the initial phase of menopause, the female might experience symptoms such as hot flashes. But as the years are going to get past, the symptoms will eventually get regressed. So the symptoms is actually going to get improved as the year passes. Is that clear? Okay. So now let's discuss about the treatment of hot flashes. So we are going to divide the patients into mild, moderate and severe. So the patient who is going to have only mild to moderate hot flashes, you need to just reassure the patients. So just reassure the patient, make sure that the patient that this is nothing but a vasomotor symptom which is every female is going to experience once they are going to attain menopause. So nothing to worry, you need not worry at all, and just reassure the patient and give some vitamin supplementation to that female. But in cases of severe hot flashes, if the patient is going to experience hot flashes very frequently and it is going to be severe in intensity, those patients can be called as severe hot flashes, right? So in patients of severe hot flashes, you need to do some definitive management. And the definitive management is where hormone replacement therapy can be administered to that patient. So the treatment of severe hot flashes is hormone replacement therapy, where you're going to exogenously administer hormone to that patient. So this hormone is nothing but estrogen. So there is some protocol for administration of HRT in females. The protocol is that if the female is going to have uterus, then you have to administer estrogen plus progesterone. But if the female is not having any uterus, you have to administer only estrogen. Why? Because it's that we all know that estrogen has proliferative action on the uterine endometrium. So if you administer only estrogen to a female who is having uterus, it is going to result in hyperproliferation of the uterine endometrium, which will result in endometrial hyperplasia and development of endometrial cancer eventually. So for that reason, in cases where uterus is present in a female who has attained menopause, you have to administer estrogen and progesterone, because progesterone has anti-proliferative action on the uterine endometrium. So if you are going to give progesterone along with estrogen in a female who is having uterus, this progesterone is going to support the uterine endometrium and prevent the endometrial hyperplasia from happening. But if a female who is not having any uterus been present, she has attained menopause now, right? In those females, you can give only estrogen because there is no uterus in that female. Once there is no uterus in that female, definitely you can give only estrogen because no uterus, no hyperproliferation of the uterine endometrium. So give only estrogen to that female. So no uterus, estrogen alone. Uterus present, estrogen plus progesterone has to be administered in hormone replacement therapy as a treatment option in severe hot flashes patient who has experienced menopause. Is that clear? Yes. The other treatment is administration of selective estrogen receptor modulator. SERM is a group of drug which is called a selective estrogen receptor modulator, which is going to have antagonistic effect in certain body parts and it is going to have agonistic effect in certain tissues as well. Is that clear? So selective estrogen receptor modulator is a drug which is going to have selective functions in different parts of the body. So which is the most common SERM which is used in the treatment of severe hot flashes is besidoxifene. Besidoxifene, B-A-Z-E, doxifene. So besidoxifene is the most common drug, most common selective estrogen receptor modulator which is administered for the treatment of severe hot flashes. Now you may have a doubt. Why is only besidoxifene is administered? Why not the other selective estrogen receptor modulators such as tamoxifen, raloxifene, clomiphene is not administered? It is because clomiphene, raloxifene and tamoxifen, the most common side effect of these three drugs is hot flashes in itself. So since the side effect of these drugs is hot flashes, therefore these drugs can never be used in the management of hot flashes because the side effect itself is hot flashes. So you are not going to use a drug which is going to have the side effect as hot flashes and you are not going to use that same drug for the treatment of hot flashes. So for that reason, these three are not used in the management of severe hot flashes and only besidoxifene is used in the management of hot flashes along with estrogen. Is that clear? Yes. So what are the other drugs which can be used? Those are selective serotonin receptor inhibitor. Selective serotonin receptor inhibitor, which is called as SSRIs, which are fluoxetine, paroxetine and venlafaxine. Right? So these three drugs can also be used in the management of severe hot flashes. So what are the three options we have? Hormone replacement therapy followed by SERMs and SSRIs are the drugs which are most commonly administered for the treatment of severe hot flashes. Is that clear? Yes. Okay. So now what are the second symptom? The most common symptom is hot flashes, which we have discussed. Now what are the other symptoms a female can experience during menopause? The second symptom is senile or atrophic vaginitis. What is senile or atrophic vaginitis? It is actually dryness of the vagina. Since the amount of estrogen is going to be decreased in a female who has attained menopause, decreased amount of estrogen is going to result in dryness of the vagina. There is going to be decreased amount of vaginal secretions and the vagina is going to be dry. So this dryness of vagina is actually because of decrease in amount of estrogen. So these symptoms of vagina, right, grouped with the urinary symptom has got a new term now which is called as genitourinary syndrome, which is called as genitourinary syndrome. So genitourinary syndrome is nothing but genital compliance plus urinary compliance. So what are the genital compliance? Dryness of the vagina, dyspareunia, which is painful intercourse, and vulvovaginal burning sensation, and postcoital bleeding, that is bleeding which happens after the act of coitus. So these are the genital compliance, and the urinary compliance are dysuria, urgency and urinary tract infections. So all these urinary spectrum and genital spectrum of compliance can be grouped together and called as genitourinary syndrome. So genital compliance along with urinary compliance, which is called as genitourinary syndrome, can happen more commonly in a female of menopause. So this syndrome, genitourinary syndrome, can happen in a female who has experienced menopause as well. The most important point is that unlike hot flashes, genitourinary syndrome is not going to get regressed as the years are going to pass. So this symptom is eventually going to increase as the years are going to pass. We all know that urinary tract infection occurs more commonly in females than males because of the short urethra. Adding to that, because of dryness of vagina and because of the physiological changes which happens in the female's reproductive system during the menopause, the female is even more prone for urinary tract infection, dysuria, and she is going to have urgency of micturition and vaginal dryness, vulvovaginal burning, postcoital bleeding, dyspareunia, and everything. Is that clear? So the major problem is because of dryness, which is going to happen because of decreased estrogen. So the first treatment of choice which are going to administer for dryness of vagina is vaginal lubricants. You give some moisturizing agents like vaginal lubricants. So the first treatment of choice for treatment of dryness of vagina or senile or atrophic vaginitis is vaginal lubricants, followed by local estrogen creams. You can have some topical application of estrogen creams over the vagina. Because of that, she might be prevented from symptoms of dryness of vagina. So vaginal lubricants, local estrogen creams, and the third track is ospemifene. Ospemifene can also be used in the treatment of atrophic or senile vaginitis as well. So basically, you're going to treat the dryness of the vagina with some lubricants, some local estrogen creams, and the drugs such as ospemifene. Is that clear? Yes. So the first symptom was hot flashes, the second symptom was senile or atrophic vaginitis, and the third most common symptom is osteoporosis. Osteoporosis is nothing but decrease in the bone mineral density, which is going to happen in a female because of decrease in levels of estrogen. So majorly, because of decrease in estrogen, the female is going to experience hot flashes, dryness of vagina, and osteoporosis. Right? So osteoporosis followed by the female might have some sleep disturbances, insomnia, some anxiety issues, depressions, and some mood changes can happen in a female who is going to attain menopause as well. So these are the symptom complex which is going to happen in a female of menopause. Is that clear? Okay. So finally, now we are revealing the investigations. So what is the investigation you have to do? Is it necessary that you have to do investigation to confirm the diagnosis of menopause? No. Because menopause is a clinical diagnosis. You never need to do some investigation in order to define a female that she has attained menopause. So menopause is a clinical diagnosis where you can tell a female has attained menopause if she is going to experience amenorrhea for a period of about 12 months. So if a female is having absence of menstruation for 12 consecutive months, she can be told clinically that she is a case of menopause. Fine. But theoretically, you need to know the investigations in a case of menopause. So menopause is all about the ovarian insufficiency. So here you need to test for the ovarian reserve. So since there is no follicles in the ovary, the levels of estrogen is going to get decreased. We all know that the most common estrogen during the reproductive age group is estradiol, which is E2. But since there is no more follicles left in the ovary at the time of menopause, there is going to be decreased in the levels of estradiol, which is going to be less than 20 picogram. So the first investigation is decrease in levels of estrogen less than 20 picogram. The second investigation is where, since the levels of estrogen is going to get decreased, therefore the negative feedback estrogen had on FSH is going to get decreased, is going to lost. Since the negative feedback estrogen had on FSH is going to get lost, therefore the levels of FSH is going to increase. So let me show you here. This is estrogen, this is FSH. Estrogen had a negative feedback on FSH. But in patients of menopause, since the levels of estrogen is going to decrease, therefore the negative feedback is going to get lost and the levels of FSH is going to get increased. So FSH levels more than 40 international units is diagnostic of menopause. Apart from that, decrease in anti-Mullerian hormone is the best test to assess the ovarian reserve. If the anti-Mullerian hormone is going to get decreased, if it is going to be less than 1, it is suggestive of menopause, and if anti-Mullerian hormone is going to be less than 0.5, it is diagnostic of menopause. Anti-Mullerian hormone is the best test because it has less cycle variability. The cycle variability is very less with anti-Mullerian hormone. Therefore, anti-Mullerian hormone is the best test for ovarian reserve. And decrease in antral follicle count. So antral follicles are the immature ovarian follicles. So if the immature ovarian follicle levels are going to be decreased in itself, therefore we can ascertain that the amount of ovarian follicle is going to be decreased as well. So therefore, decrease antral follicle count, decrease in anti-Mullerian hormone less than 0.5, increase in FSH, decrease in estradiol less than 20 picogram. All these are the investigation which will direct you towards decrease in ovarian reserve. Right? So these are the investigations you need to learn. Apart from that, the most important point is that the most common estrogen in menopausal female is E1, which is also called as estrone, which is a weaker form of estrogen, because estrone is the estrogen which is actually produced from the adipose tissue and the adrenal gland. So these are the weakest form of the estrogen, which is E1, which is also called as estrone. Is that clear? Yes. So finally, coming to the last part of this module, right? So if you do vaginal cytology, where you're going to take the cells of the vagina and you're going to demonstrate it, you're going to examine it under the microscope of a menopausal female, right? So the vaginal smear has been taken and you're going to do some cytological study. In the cytological study, you can see some cells predominantly which are the parabasal cells, right? There is going to be predominantly parabasal cells. So we all know that there is an index called as maturation index, which is actually 3 numbers. And these 3 numbers, the first number is parabasal cells, the second number is intermediate cell, and the third number is superficial cell. In a patient who has attained menopause, since there is a decreased amount of estrogen in her, therefore the number of superficial and the intermediate cell is going to be decreased and become 0, and only the parabasal cell is going to be present. Right? So menopause is equal to parabasal cells. So in a patient who has attained menopause, the vaginal cytology, the cell which you are going to see is only the parabasal cell. So the maturation index in menopausal female is 100 bar 0 bar 100 bar 0 bar 0, because the number of superficial cells and the intermediate cells are decreased in a female who has attained menopause, because superficial cells and intermediate cells are seen only during the reproductive age group when there is increase in amount of estrogen in a female, right? But in a patient who has attained menopause, there is a decrease in amount of estrogen. So when the amount of estrogen itself is going to be decreased, therefore there is going to be no superficial and no intermediate cell. Therefore superficial cells and intermediate cell becomes 0, and parabasal cells are going to be maximum, that is 100. So the maturation index in menopausal female is 100, which is parabasal cell, 0 which is intermediate cell, and 0 which is superficial cells. Is that clear? So if there is an MCQ which states the maturation index in menopausal female is what? It is 100 bar 0 bar 0. Is that clear? Yes. So until now we have discussed about the major symptoms of menopause and the treatment as well. So in the part 2 module of menopause, we'll be discussing about the osteoporosis, what is osteoporosis, and what are the most common fractures which happens in menopausal females, and what are the investigations, and what are the treatment of osteoporosis, and hormone replacement therapy will be discussed in detail in the subsequent module. I hope I have made this topic very simple and clear for you. In case if you have any doubts regarding this topic, you can please write to me in the Mackler Gmail handle as well, or in the Instagram handle. I will reach out to you as early as been possible. Right? Until then, please keep studying, students. Please subscribe to Mackler YouTube handle for daily video updates. Right? Thank you.